Hi, my name is Amanda Ralph. I'm a nurse practitioner and the owner of White Coat Aesthetics here in Las Vegas, Nevada. Today, I thought it'd be fun to discuss the differences between needle and cannula use. Specifically, this is obviously targeting dermal filler. It is very rare, if not, I don't know if I've ever seen Botox used with a cannula. I would not recommend it. So most of the time we're talking about injectables, filler, Sculptra, Radiesse, using both of these modalities. So let's get started on talking about needles. There are actual different needles that you'll see in the market that are commonly used. There's regular syringes that you can just attach to a needle. A syringe can come in anything from 1 mil, 3 mil, 5 mil, 10 mil, 20 mil. And then we also have little insulin syringes. So these are BD insulin syringes. They come with 30 units, which is why they're commonly used for Botox or Dysport, but it is really 0.3 mil. And then with that, we have various gauge sizes and we have different lengths. So we have our tiniest one here, which is most commonly used for Botox and Dysport. Like I said, it's 5/16 inch and it is 31 gauge, so extremely, extremely tiny. Then the other one that is more commonly used when it comes to areas that you need a little bit more depth is going to be our 1/2 inch syringe. And this one is a 29 gauge needle. Very, very, very small still. It's just a little bit longer. I prefer this for like masseter Botox or Dysport. Obviously, we want to get deeper into that muscle. And then I will also use this. I will backfill this with filler to do lip filler. I will usually go straight to bone here at the Puriform for filler. What you have to understand is because it is a tinier gauge than what you are usually getting for your filler product, it's a lot harder to push filler out of this, and you really have to muscle your thumb in there to get that product out. So something to just note and something that you get more comfortable with over time. This is another very common needle that you will see come in a filler package. And this one here, I believe, is a 29 gauge 1/2 inch as well. This one is more common for the Restylane products, and not all of them, but this is one of them. And then, like I said earlier, this one usually comes from Allergan, and you will often see it used with Voluma or Volux. And you can, most of the time, switch these needles around as you would like to. And I always change my needle a lot when I'm going down to bone on cheek or on jaw, not quite so much when it comes to a soft tissue area like the marionette, nasolabial fold, or the smile line. A sharp needle makes it less likely to bruise, okay? It's less painful and it is less likely to bruise. So as much as you can change a needle to make it sharp, the better. If you can change it every poke, that would be ideal, but it's a lot of money to you if you are having to change the needles quite as often. Now let's talk about cannula. Cannula is similar to a needle in that it is a long metal, but it is not sharp. So it is actually a blunt tip. As you can see, I can poke this. It doesn't go through the skin at all. It doesn't hurt. It is a blunt tip cannula, and it is longer. So this one here is 1.5 inches. There are cannulas that go up to 2 inches. They're maybe even longer, honestly. I use always 1.5 inch or 2 inches. And what helps you determine your length that you want is the area you are trying to reach. So typically this is used for under eye, smile line. I do cannula work when it comes to the jaw and the marionette. And the areas, I would say 1.5 inch is great when it comes to under eye, when it comes to smile line, when it comes to marionette. For jaw, you can probably use a 2 inch and get to where you want to. The whole idea is that you are not having to poke as much as you are with a needle. What I want you to understand, so with a cannula, of course, I just demonstrated to you that it will not pierce through the skin. So how do we get it through the skin? We use a pilot needle. This comes with the cannula in your box of cannulas, and it is typically a slightly larger gauge than the cannula itself, so that the hole is larger and it is easier to insert the cannula through. For this example, this cannula that I have here is 27 gauge, which is very small. I actually would not recommend using a 27 gauge cannula, but it's what I had to use. So for this, the needle gauge on this one is a 25 gauge. So slightly larger than the 27 gauge. Like I said, the smaller the number on the gauge, the larger it is. So it gives you just a little bit more room to work with. Let me kind of see if I can open that and show you how that works. The pilot needle is just that. It is just a needle. You never, I mean, you could, but you never attach the filler to this. What you do is you take the needle out, you poke a hole in the skin, and then you go ahead and you recap it so that it stays sterile, or at least clean. At this point, it's no longer technically sterile. And then you go ahead and use your cannula inserted into the skin. Couple things to note with cannula is that the whole purpose of cannula is to do smaller pokes. So usually you will do just one pilot hole to get to all of the area that you are trying to reach with the filler. When it comes to under eye, I typically do a little porthole here. When it comes to the smile line, I usually do one at the bottom of that smile line so that when I go ahead and insert the cannula, I'm getting to everywhere I want. The nice thing about cannula is there's a slightly less risk of bruising because you usually just do the one poke and then from there it is just slightly gliding under the skin. Of course, bruising can always happen because you may accidentally insert it into a vessel, which can happen, but minimizing bruises is great, especially in aesthetics. So what I will usually do is make as few pilot holes as I can. Some people, before they do the pilot hole, will do a little bleb of lidocaine with epi to attempt to avoid a bruise. I don't do it in my practice, but you definitely can. The reason being is that lidocaine itself is a vasodilator, so it will bring more blood to the area. So if you're just using lidocaine to numb the pilot hole, you're actually probably making them a little bit more likely to bruise. But bruises can happen. We know that this is a risk, so it's not something that you can completely avoid. Some people also like to say that a cannula makes you less likely to have a vascular occlusion. As we've discussed before, vascular occlusion is when filler gets into a blood vessel and then limits blood flow to an area of the tissue, which potentially would kill the tissue. But what I will say is that they all want, basically the most recent teaching is that you can still cause a vascular occlusion with the cannula, so you can never feel 100% safe, and you always want to be able to act on or treat a potential vascular occlusion in your practice. Another thing to note with cannula, to stay the safest, you actually want a larger diameter cannula than a small one. Like I said, this is 27 gauge, which is so tiny that effectively, if you are pushing hard enough, can still act as a needle. So I always recommend 25 gauge or larger. So 25 gauge, 23 gauge. If there's a 22, 20 gauge, I would also recommend that. If it is too large, it can kind of be harder to use. So I think a 23 gauge, 25 gauge cannula, 1.5 inch is probably perfect for everything you need. The hardest part about learning to use a cannula is one, being able to figure out how to insert the cannula into the pilot hole without too much trauma to the surrounding tissue. And two, is trying to keep and maintain this proper depth that you need to be. Because the one thing about the cannula, you can pop all the way down to bone or at least under muscle. Sometimes, though, the goal is not to poke all the way down to muscle and bone. Sometimes the goal is to stay in that dermis level, that deep dermis. And so some practice and skill is needed, some proper training to make sure that you are in the proper plane when it comes to cannula work. And it can be such an amazing treatment and do everything you need if you know what plane you need to be. And I think that's the most common difficulty for newer injectors, is knowing what plane that they are in and knowing how to stay in the plane that they want to be. A lot of this, of course, will come with hands-on training. One thing I will say is the more that you practice with cannula, the better you will get. And everyone always wants to kind of jump into cannula work when they're very new. And I would just urge you, get very comfortable with needle first before trying to move over to cannula. It will make you a better injector. It will make you more confident in what you are doing if you give yourself time to learn needle first. Every injector is going to be different, but what I will say is that I have my favorite areas for needle and I have my favorite areas for cannula, and I'm going to walk you through these. Of course, when it comes to Botox upper face needle every day, I usually typically use that insulin syringe. When it comes to needle, the areas I prefer are when I can go straight down to bone and drop some product. So in the cheek, especially the lateral cheek, I typically do a needle. I will typically do needle in the front of the chin and off to the side of the chin for that pre-gel sulcus. I will do some needle at the back of the jaw here to kind of give a lift up on the skin. Sometimes I will do needle in under eye. Obviously, this is a more high-risk area, and I'm very particular about the clients that I will use this technique on, but sometimes I will go straight down to bone and drop a little product. And I do love needle on bone right here at the nasal ala or the piriform aperture. So this is an area I really prefer the needle as well. When it comes to cannula, I love cannula when it comes to this medial area of the cheek. I love it for under eyes. And I love it when a person has a very deep under eye that also connects to like a malar fat pad. So this entire area needs some filler. With that, I want my cannula extremely deep. I don't even want to be able to see the cannula when I'm bringing it up. It's very, very deep under the muscle, under the superficial fat pads. I love cannula when it comes to smile line. The reason being is it helps me avoid this artery here, our facial artery that is coming up. And it also helps me prevent bruising. I absolutely love cannula on the jaw right here to avoid our facial artery that comes out here right in front of the masseter and that antegonial notch. I love cannula throughout the jaw. I also love it right here. And what I will do is I will do a pilot hole right here in the kind of in the front of that jowl. I will come here, do a little jawline work. I will bring it up and I will help this, which we kind of consider that marionette line area / chin. What it does is it kind of softens that divide from the chin and the jaw. It really helps blend this area. So I will do one hole here and then I will come through and use my cannula all the way here. And I can do cannula for chin, but I typically do prefer just to go straight needle on bone for this. I really like needle when it comes to lips. I don't really like cannula. I think needle helps me be just a little bit more precise in the area that I want to go. And the last area I want to mention is temple. This is kind of a controversial area. A lot of people are kind of talking about it right now because Voluma just came out with an indication for temple. The training with Voluma and the indication came from actually needle on bone all the way deep in the cannula. For me, typically when I'm doing filler, I actually use cannula. I typically like to insert right at the zygoma here or kind of at the hairline and get this whole area. And I'm placing that product more superficially rather than down on bone. But I have used both techniques. So let me know if there's anything else I can answer for you. I would love to hear.